Hi, I'm Joanne, and welcome to Daily Grommet. Every day we tell stories, usually those stories about products that we hope you'll enjoy. We have lots of fun doing that. This week, during the season of giving, we will suspend talking about products, and we're going to tell you stories that are really worth telling. We'll be focusing on a different organization to share with you the stories of good that people and organizations are doing around this country, locally, and around the world. Today, I'm so proud and honored to be here with Cheryl Kane from Boston Healthcare for the Homeless. I'm also here with my friend Sarah Pacelli. She's a Daily Grommeter, and she brought this story to us. So go ahead, Cheryl, please tell us. Tell us about yourself a little bit and tell us about Boston Healthcare for the Homeless.
Boston Healthcare for the Homeless program was founded in 1985, and our mission is pretty simple but very compelling. Basically, we provide health care to homeless men, women, and children in the greater Boston area. And to date, we have about 11,000 patients that we provide care for, and we do that in over 80 different shelter clinics and hospitals within the Boston area. And the wonderful thing about our program is that we focus solely on our mission. We aren't involved in housing or shelter or anything. We focus solely on the mission. When I used to go out on the overnight van at night, we would climb down this bank of the muddy river, and there would be a whole group of people living under the bridge, and they would have their pills lined up on the girders of the bridge. Just they'd tell the doctor, you know, I need a refill on this one and this one. And all of my life I felt really called to working with people who are on the margin of life. In the early 90s, I decided that I really wanted to focus solely on working with homeless men and women. And so I was doing education in a local shelter, helping them to learn how to write resumes and to do job interviews. And from a distance, I used to watch the men and women from Boston Healthcare from the Homeless program, and I was so inspired by the care and the dignity and the compassion that they showed to their patients that I decided that this is really what I want to do for the rest of my life. So at age 42, I went
young.
That's young. Now it is. I went back to nursing school. I went back to Boston College School of Nursing, and when I was in my last year of nursing school, I met a man that I absolutely fell in love with and was crazy about. We were married 1.5 years when he was diagnosed with a brain tumor. He was able to attend my graduation, but as soon as I finished nursing school and was working with Boston Healthcare for the Homeless program, within 6 months, he died. And so I just felt so devastated. I had no passion in my life. You know, I was newly married, and now I was a widow. I was a new nurse. I basically didn't know whether I was coming or going. At a staff meeting at Boston Healthcare for the Homeless program that summer, I was watching a video, and it was called Street Doctors. And for the first time, I felt that kind of fire in your belly about, oh my gosh, there was like a sense of aliveness. And so at that point, I started working as a street nurse.
I'm just in awe of you.
Wow.
In your organization. I just think it's amazing. From what I understand, you've always operated in the black.
Right.
Which a lot of organizations can't say. I mean, I'm not even sure if I can say that personally. So I think that's really cool. And then right now you have something going with the Kresge Foundation.
Right now, until the end of the year, you know, we're trying to finish the paying for the building, and so that every dollar that's donated will be matched by the Kresge Challenge. So it's like a 2-for-1.
So this is what you can do. You can share this with people who you think might be interested in knowing about Boston Healthcare for the Homeless. You can also donate. We would love that. It would be so helpful. And Cheryl, thank you so much for coming today.
Thank you. Thank you both.